Is brought to you by Pfizer.
CBS Health Watch sponsored by Pfizer.
Anderson Cooper 360. Brought to you by Pfizer.
ABC News Nightline. Brought to you by Pfizer.
Making a difference. Brought to you by Pfizer.
CNN Tonight. Brought to you by Pfizer. Early Start. Brought to you by Pfizer. Friday night on Aaron Burnett Out Front. Brought to you by Pfizer.
This Week with George Stephanopoulos is brought to you by Pfizer.
This weather report brought to you by Pfizer.
Today's countdown to the royal wedding is brought to you by Pfizer.
And now a CBS Sports Update brought to you by Pfizer.
Meet the Press Data Download. Brought to you by Pfizer.
This portion of CBS This Morning sponsored by Pfizer.
On how to find the hidden sugars in the American family diet. Sponsored by Pfizer.
Vaccine CEO Albert Bourla, who claimed that the vaccine was 100% effective in preventing COVID, has just revealed that he is sick with COVID. That's right, ladies and gentlemen. Here is a tweet that he put out back in April of 2021. I'm excited to share that updated analysis from our Phase 3 study with BioNTech also showed that our COVID-19 vaccine was 100% effective in preventing COVID-19 cases in South Africa. 100%, he says. Well, fast forward to August of 2022, I would like to let you know that I have tested positive for COVID-19. I'm thankful to have received 4 doses of the Pfizer-BioNTech vaccine, and I am feeling well while experiencing very mild symptoms. I am isolating and have started a course of Paxlovid. He then went on to say, "We've come so far in our efforts to battle this disease that I am confident I will have a speedy recovery. I am incredibly grateful for the tireless efforts of my Pfizer colleagues who worked to make vaccines and treatments available for me and people around the world." In November, Bourla said that those who spread misinformation about his experimental mRNA COVID injections are, quote, criminals. Yeah, he said, "Those people are criminals," he told the Atlantic Council. "They're not bad people, they're criminals because they have literally cost millions of lives. The only thing that stands between the new way of life and the current way of life is, frankly, hesitancy to vaccinations." So isn't that interesting? Would he now consider himself a criminal for literally spreading vaccine misinformation? I highly doubt it. Pfizer successfully lobbied the U.S. government and other governments around the world to mandate that all citizens inject his pharmaceutical product in order to have a job or to attend school or to visit public venues. Most COVID restrictions were lifted over the past year due to widespread backlash and overwhelming evidence proving that Pfizer, Moderna, and Johnson & Johnson experimental vaccines were total failures at stopping the spread of COVID. And indeed, they were and are. The CDC is now announcing that they're completely going to overhaul themselves after botching the pandemic. As we see here, it's over. CDC says people exposed to COVID no longer need to quarantine. Yeah, just like that, it's over, folks. This is huge. In bureaucratic speak, this is a near complete cave-in to the actual facts. And here's the new guidelines from the CDC, who focuses on individual decisions. Those exposed to the virus are no longer required to quarantine. Unvaccinated people now have the same guidance as the vaccinated people. Students can stay in class after being exposed. You know, it's no longer recommended to screen those without symptoms. So no symptoms, no problem. Vaccinated or unvaccinated, same guidance. Exposed, no need to quarantine. Students exposed, well, they can stay in class. I mean, what the hell is this, right? Well, if you manage to maintain your integrity throughout this awful period of time, congratulations. You are one of the rock stars of this story. You are a solid individual who has courage and stood firm and tall when it mattered most. And I am happy to say that I indeed do fall into that camp. I certainly hope that viewers of this channel have as well, because the truth is all starting to be revealed. It's all starting to come out. In fact, right now, lawsuits are literally being won. As we see here, first settlement reached for healthcare workers in a lawsuit filed over COVID-19 84 vaccine mandates. The first settlement in the U.S. has been reached in a class action lawsuit filed by healthcare workers over a university system's COVID-19 84 vaccine mandate. Chicago-based North Shore University healthcare system has agreed to pay more than 500 people, current and former healthcare workers, a total of $10.3 million as part of the terms of settlement. It's also changing its policy to accommodate religious exemption requests and rehiring former employees who were fired or forced to resign, whose exemptions requests were denied. So indeed, this is a great step in the right direction, but at the same time, guys, we still have articles with headlines like this just becoming the norm around the dinner table conversations, Omicron symptoms affecting the fully vaccinated. So with all of this going on, settlements being settled, the CDC backtracking on this, announcing they've totally botched this thing, the Pfizer CEO doing a big flip-flop here. So while we're watching all of this, what is Canada doing? Well, as we see here, Quebec has just launched a massive COVID-19 84 vaccine campaign ahead of the fall. That's right, Quebec is now offering a 5th dose of COVID-19 84 vaccine to all adults as of August 29th, guys. So we're going to talk about all of this and much more in this video. But really quickly, if you do appreciate my efforts, I'd quickly just ask that you check me out at pressfortruth.ca/donate. Here you can do PayPal, you can do Bitcoin, you can do other cryptocurrencies. You could add me on Subscribestar. You can sign up here for a monthly reoccurring contribution. You can do an e-transfer to Dan at pressfortruth.ca, or you can also send stuff to my P.O. box, guys. Links are located in the description below. Of course, you don't have to. You can continue to consume my content for free, and I highly welcome that. But if you do appreciate my efforts to bring you this information, and you are financially able to contribute to my efforts, well, it certainly would be greatly appreciated. Please check the links in the description below. All right, guys, let's start with this. Now that the CDC has finally admitted that there is a natural immunity after COVID infection, all unions should demand the reinstatement with back pay for unvaccinated employees that were fired. And I would absolutely have to agree. I mean, this is clearly a step in the right direction, but it needs to go much, much further. This is the first of its kind class action settlement against a private employer who unlawfully denied hundreds of religious exemption requests to COVID-19 84 shots, Liberal Counsel said. Its founder and chairman, Matt Staver, said it should be a wake-up call to every employer that did not accommodate or exempt employees who opposed the COVID-19 84 shots for religious reasons. Let this case be a warning to employers that violated Title VII. And indeed, I certainly hope it will be a stark warning. Because, as I said, everything is changing right now, but that's not stopping the Canadians from marching full steam ahead into the inoculation program. But let's take a look at this. For those of you who managed to stay away from this, congrats. But as for the people who didn't, some can be forgiven, but many cannot. Those who could have and should have known better, well, the doctors who failed to utilize known and proven early treatments to save lives, they should have known better. Or the public health authorities that locked people down and forced masks onto children's faces without a shred of supporting science to back those decisions. Medical hospital administrators who took the monetary bait and forced patients onto toxic and deadly regimes of remdesivir and ventilators, and again, without any supportive evidence. The NIH treatment panel that still to this day does not recommend vitamin D or any other actual safe and effective early treatments. Sorry, not sorry. Those people need to suffer real and lasting public consequences. Some doctors should lose their licenses. Some bureaucrats need to lose their jobs, while others need to go to trial. I feel most acutely for those who got caught up and suffered terribly as a result. I feel truly awful for all the people who were prevented from being at a loved one's passing, or who, as a condition of continued employment, were coerced into getting COVID jabs, neither that they wanted nor needed. There are far too many tragic cases out there. Far too many young lives were lost and continue to be lost. I'm angry that it happened and at the petty, ignorant bureaucrats who forced it to happen. Sudden adult death syndrome is a thing now, and the attempts to normalize it by the press have left me thinking that those companies and journalists who engaged in this ought to be barred for life from ever being in the businesses again. And that's why I showed you that clip in the intro of all these news pundits and agencies and channels being sponsored by Pfizer. Why are they going to bite the hand that feeds them? Here are a few of many such candidates of people pushing this nonsense sudden death syndrome idea. Little known heart attack that's striking fit and healthy women as young as 22, or cold weather is affecting your body and could cause blood clots, or sudden heart attack, cardiac arrest comes from something you just drank. Guys, I perhaps topped this with this one, unbelievably. Student dies of joy after acing exams while U of T mandates boosters for students. Yeah, you can't make this stuff up, guys. If you missed that video, be sure to check it out. I will include links to all of this in the description below. But here's where we're at, guys. This is just unbelievable stuff. And here's the problem with what the CDC is now announcing in terms of their overhaul of the botched pandemic. As we see here, more than 2 years of missteps and backpedaling over COVID-19 84 guidance that had a profound effect on Americans' lives. The CDC announced on Wednesday that the agency would undergo a complete overhaul and will revamp everything from its operations to its culture after failing to meet expectations during the pandemic. So here's what they said. For 75 years, CDC and public health have been preparing for COVID-19 84, and in our big moment, our performance did not reliably meet expectations. I want us all to do better, and it starts with CDC leading the way. My goal is a new public health action-oriented culture at CDC that emphasizes accountability, collaboration, communication, and timeliness. So here's, as Bloomberg further notes, the agency has been faulted for inadequate testing, their surveillance program, not collecting important data on how the virus is spreading, on how vaccines were performing, for being too under the influence of the White House during the Trump administration, and for repeated challenges communicating to a publicly divided and sometimes skeptical about this in the public. And here's a few examples. So, CDC has spread misinformation on masking. It's not science. CDC admits no record of natural immunity transmitting COVID-19 84. The CDC's masking flip-flop, as I documented while it was happening. The CDC admits it gave false information about COVID-19 vaccine surveillance. CDC admits it can't back claim that vaccines don't cause variants or causing coronavirus confusion again. So the CDC is being exposed time and time again for the mistakes. The CDC overhaul comes on the heels of the agency admitting that unvaccinated people now have the same guidance as vaccinated people, and those exposed to COVID are no longer required to quarantine. But here's the problem, guys. They're not going to be solving the problems that you think need to be solved. In fact, they're going to be looking to the logistics of getting more shots into more arms of the people of the world. So this overhauling of the CDCs in response to their pandemic response is all about the next big one that is coming down the pike. This is what they've been warning us about. This is why we're seeing in Quebec right now, they are taking the preventive measures of starting to, worry about this now, they say, before it's too late. And as I've shown on this channel over the years of covering this, that what we often see happening in Quebec, it happens there first, almost like they're using it as a blueprint, and then it slowly trickles into the rest of Canada. So what are they looking at right now, guys? Well, they've just launched a massive COVID-19 vaccine campaign ahead of the fall. Quebec Premier Legault says his government is launching a massive vaccine booster campaign to get ahead of the next wave of COVID-19 84. He told reporters in Quebec City that all Quebecers over 18 will be eligible to make an appointment to receive the booster. He says residents can get a booster if it's been 5 months since their last COVID vaccine or 3 months since they were last infected with the novel coronavirus. It's amazing that people can just talk about that like as if it's normal, just like these kind of headlines. Omicron symptoms are affecting the fully vaccinated. Well, yeah, that should be a sign that they're either not working or they are working exactly as they have been designed to be, which is to eventually set up some sort of a subscription-based model on your immune system so that, as we've already seen them announce, you'll have to eventually get the vaccine every 6 months, possibly even every month, as new variants continue to come out, as we know that this is all part of the plan. So just wanted to bring all of this stuff to your attention, ladies and gentlemen. I'm sure you've probably already known about the, Pfizer CEO claiming it was 100% effective at preventing COVID. Well, now he is sick with COVID, totally being exposed as sharing misinformation, which he claims is criminal. So I guess he is now considered a criminal according to his own logic. And as I said, the CDC has changed their guidances, they're backtracking, but I think this is going to move into stricter logistics for lockdowns, passports, vaccine passports, no-fly zones, all this sort of stuff, which will be coming back as we are currently in the eye of the hurricane, the calm before the storm. Just wanted to bring all that to your attention, guys. Once again, if you do appreciate my efforts to bring you this info, don't forget to check me out here at pressfortruth.ca/donate. Thank you so much to anybody who does take the time to support my efforts. Again, you can do that by checking the description below, whether you happen to be watching this on BitChute or Odyssey or Minds or maybe Bastion or Hive or maybe even YouTube, wherever you happen to be watching this, check the description. I don't put all the links on my website, so if you're watching on my website, go ahead and click one of the links to any of the video platforms that I share on to get all the sources for these videos. And that's all for today, guys. I want to thank you so much for tuning in. Don't forget to click that thumbs up button. Share this video with your friends and family who you think need to see it the most. And stay tuned. We're going to have more video reports coming very soon. This is Dan Dix reporting for Press for Truth. We all want truth. The truth will set you free.